Hello, dear students. Today we are going to discuss about what is the meaning of patient compliance and which are the factors that are responsible for whether the patient compliance is good or poor. So now, what is the patient compliance? Patient compliance means all the instruction given by the consultant or healthcare professionals, all the instructions related to the treatment of the disease, whether the patient is following all these advice and up to the extent that has been told by the doctor, that is called patient compliance. Now, there are two terms, please don't confuse with these two. Nowadays, even the patient compliance is replaced with the term patient adherence because as you can see that patient compliance means patient has to comply, so it is a passive term, while in case of adherence, the vigor with which, the consistency with which the patient remain adhere to the guideline or the instructions by the healthcare provider is called patient adherence. So don't confuse with. So now the instructions that the patient should follow that are provided by the healthcare professionals, these are divided into four main categories. One is the advice related to the medication use. In these, all the instruction related to the drug, dose, frequency, duration, when to take the drug, some advice related to the meal and all that, and the duration of the therapy must be followed. That is one. Second is the instruction given in related to the therapeutic procedures. Say, for example, there is a some wound is there, so dressing of the wound. If the physiotherapy is suggested, follow that therapy. So instruction related to the all therapeutic modalities. Then very important is the instruction related to the lifestyle modifications. Now, you will know that in the majority of the non-communicable diseases like diabetes, hypertension, obesity, follow-up of lifestyle measures in terms of either diet or exercise or yoga or meditation, all this should be followed as instructed by the healthcare provider. And and last but not the least is patient has to strictly the follow-up visit as advised by the healthcare professional. So all these four parameters, medication use, instruction related to therapeutic procedure, lifestyle modification, and timely follow-up and regular follow-up, all these collectively come under the heading of patient compliance. So now the question is that what are the causes of poor patient compliance? Because the patient compliance means the patient is following the instruction as provided by the doctor. Now what are the reasons that patient is not following the advice of the treating consultant? And it is divided into the two main broad categories. One is those related to the drugs, and second is the other factors. Now, related to the drug, it is very obvious. If the number of the medications are too much, it is always a patient would be more compliant if he or she has to take a single tablet a day. Okay, rather than two, three, or four, or some complex regime like one before meal, another after meal, like that. Second is compliance in case of an injectable. It will be definitely less as compared to the oral route. And last but very important is longer duration of the therapy. You know that there are the lifestyle diseases like diabetes, hypertension, where patient has to take for not long duration, lifelong therapy is there. Okay, and over and above this, more the adverse effects of the medications are there, the chances of the patient's compliance will be very poor. And here I want to give one example that rifampicin, you all know, it is an integral component of the anti-tubercular therapy, and it has been documented that ideally it should be taken on the empty stomach before the breakfast. Okay. But as the rifampicin causes significant GI tract upset, and the main studies found that doesn't just stop taking the rifampicin, which we can't afford in the treatment of the tuberculosis. So now, when the guidelines says that take the rifampicin with the light breakfast. So this is how the adverse effects affect the patient compliance. And obviously, if the cost of the therapy is more, and in addition, if that therapy remains for a longer period of the time, the patients start to stop the drug. Now, in case of an antimicrobial agent, this poor patient compliance reflected in antimicrobial resistance, because if an antimicrobial agent provided for a period of 5 days, or say for example 7 days, and if the patient just stop the agents after 2 to 3 days because he feels clinical improvement, then there are chances of resistance. Okay. And if you can see in the slide with the different font, that one of the most important cause for the resistance is clinical cure occurs much more earlier than the bacteriological cure, and that is there in case of the infection. And the classical example is tuberculosis. Patient starts improving within 1 month of the therapy, gains weight, the appetite again improves, and so he or she feels that now there is no need to take these 4 or 5 tablets, and that's why the patient stop the therapy, and then the resistance develops. Okay. Then one another point is lack of knowledge or awareness. Say for example, in case of the hypertension or diabetes or hyperlipidemia, there are such obvious no symptoms. That's why I mentioned asymptomatic disease. But these are all the silent killers. Okay. Then if the patient is having some mental disease, or is in a depressed mood, then again the compliance will be poor. And last, it is very obvious that the compliance is directly proportional to the trust of the doctor. So if the concept of the patient compliance, if it is clear to you, then please subscribe this channel, Pharmacology in Simplified Way by Dr. Darshan Dave, and share this topic with your colleagues. In future, I am going to upload the similar topics which clear the concepts in the pharmacology. Thank you very much.